So we are going to go ahead and get into the 2026 HUD data standard changes. And before we get into the specific changes, I want to make just a quick note of our timeline. So last week, Amanda and I have already updated the screens. So all the changes that have come down the pike from the federal level, we've already made the changes to the screens. Now that doesn't mean you're going to see anything different because on 10/1 is that's the go live date. From 8 to 10 a.m., we're going to be implementing those screens, making them active for you. So please, please, please do not do any data entry between 8 and 10 a.m. on 10/1. Amanda and I are going to be in the system. We're going to be making changes. We're going to be updating screens, and everything is required to be collected starting on 10/1. So if you're in there while we're making changes and you've collected certain data that is not actually in there yet, you have nowhere to put it, or whatever it is, you're not going to be able to do anything with it. So you're going to have missing data. So from 8 to 10, we're asking you not to do any data entry on that date. It might not take us that long. We'll send out an email when we are completed with what we have to do. If it's before 10 o'clock, you can go ahead and get started with whatever you have to do that day. But we're asking at least from 8 to 10 to hold off on any data entry. Then from 10 a.m. on, we'll be available for support. If you're not seeing the changes that we're going to go over in a second, if you're seeing something that's missing, if you're seeing too many things that you think you shouldn't be collecting, whatever it might be, let us know. We're available. We're going to be available the entire day and obviously every day after that for any questions you have about what you're seeing in HMIS. Okay. So I'll just stop there real quick to make sure. Is there any questions about that timeline? Pretty simple, but I want to make sure everyone's got that. Okay. Two quick notes. For those of you who are obviously you're here because you're an HMIS participating agency. If not, you still want to make sure that you have basically all of your internal forms and all your internal documentation, whether it's your electronic medical record, your paper forms, whatever it is that you're using to collect the data to put into HMIS. You have to update your forms to match these data standard changes so that you make sure you're collecting it. You're going to see some language changes. If you decide you don't want to make those language changes and they sort of are the same, right? Whatever, you don't want to make those changes on your forms, fine. But if it's something that's new that's added, something that's, significantly different, you want to make sure you're updating your forms so that you are collecting the right information. Okay. And Amanda appropriately reminded me today that we also have to update our policies and procedures because there are new data elements. Excuse me. So we're going to have to make some changes to our policies and procedures and our allowable percentages for some of these new data elements. How much of it can be missing, how much of it can be client prefers not to answer, all of those things that are sort of outlined in our policies and procedures. So we're going to have to update that. And when we do that, we will, I believe we're going to have to get it approved by the advisory board, and then we will send it out when it's finalized. Okay. So with that, I will turn it over to Amanda to go over some of our first few changes.
Thanks, Nick. Welcome, everyone. Thanks for being here today. So I'm going to start going over the data standard changes. I'm going to tell you a little bit about the field that's going to be changing, what screens it's going to be found on, and what programs they affect. So the first updates we're going to see are on our profile screens, and our first fields are race and ethnicity. The change is going to go to only collecting Hispanic and Latino, Latina and O. Right now, we're collecting it as Hispanic, Latino, E, O. So this is now a not required field, but we are going to be still collecting that on the local level. The next field that's going to be changed is the gender. Again, this is not going to be required on the federal level, but we are still going to be collecting this on the local level. So you're still going to see these on your profile screens. It's just going to be a little bit of a different change there for the race and ethnicity, excuse me. I see a question in the chat real quick. Sharon asked, will you make the updated forms available to us? I think, is that a question in regards to the internal forms, Sharon? that Nick had touched about earlier?
Yes.
So that's going to be the responsibility of your guys' individual agencies of what forms you guys are utilizing. You guys are going to have to update that in internally in your own agencies. The forms that we will, or excuse me, what we'll make available to you guys is going to be the updated HMIS policies and procedures.
Yeah, OHS has historically just stayed away from creating forms because you all use different forms, right? You all use literally different mechanisms to collect the information, and so putting out a form and having to keep up with it, especially when you all use different sort of systems and such, it's hard for us to do. So make sure you update that internally. Please go ahead and mute.
All right. Going to go ahead and move on to the next slide here. So now we're moving on to different changes we're going to see on the program screens. So the first field is the housing move-in date, and that's going to be on the enrollment screens. And this is affecting all projects. We're currently collecting the housing move-in date now. However, the change is going to become available for all VA, GPD, case management, housing retention programs. Excuse me. This field will obviously remain on all housing project enrollment screens, so that's not going to be going away. It's just going to be now available for that specific VA project. Our next field is sex. This is going to be an added field. That's going to be on the enrollment screens as well. All projects are going to be now required to collect this on their enrollment assessment. And the options now are female, male, client doesn't know, client prefers not to answer, or data not collected. So this is what Nick was talking about when we're going to have to update our policies and procedures just to see, what percentages of missing or null data or, client prefers not to answer percentages. So more to come on that when that gets approved.
Yeah, and I just want to make a note that this is the big change, right? That the federal government is saying, we have to identify basically biological sex. And I know that can be an uncomfortable conversation for a lot of folks that we might come in contact with. Do the best you can. We are still going to collect that gender field locally because we want people to be able to identify the way that they want to, and we can still collect that information. It just won't be on any federal reporting. So that's something to keep in mind. We want to make sure that we collect the sex the way that they're asking us to, so that federal reporting will report it correctly. But we wanted to keep gender locally so that folks can make their own decisions about how they identify. There was a question in the chat real quick, Amanda, about locally will the race and ethnicity field be required? So race and ethnicity is still federally required to collect. The only change there was that there's a language change about how we're defining Hispanic, Latina, Latino. I just want to go back to it real quick. The additional race and ethnicity detail. So when you select other race and ethnicity, there's something that comes up that says additional detail. Before that was a requirement. You would have to type something in there so that we wouldn't let it would not go away. It would come up as an error if you try to save it. Now it's not required. So you don't have to type anything if you choose other, basically, is the big change. So locally and federally, race and ethnicity is still going to be a requirement.
Thanks, Nick. I also want to touch piggyback off of something with the federal reporting. I know Nick mentioned with the LSA, the gender is not going to be required in those types of reports. However, if you guys are wanting to know more of our continuum-wide data in those now not federally required data elements, we can still provide that data for you if you guys are looking at on our local level. However, that's just not going to be on the federal level. So if you are wanting to know anything about the gender or specifically the gender, you can reach out to us and we can still pull that data for you on our system. Okay. We're still looking at changes on our program screens, and the next field is the translation assistance needed. This again is on our enrollment screen for all projects, and this field is not required federally. However, in our local community, we're going to continue to track that on the enrollment screen. Sexual orientation is another change here. This is found on the enrollment as well as the profile screens, and it affects all projects. Again, this is not going to be required on the federal level. However, we're still going to require it on our local level. So that's still going to be seen in your enrollment and profile screens. Any questions regarding these fields?
So just real quick for those PSH providers, you'll know that, Amanda sent out a plenty of data quality monitoring emails where, the sexual orientation was required for a PSH program specifically. So it's no longer required there and it won't be on the APR any longer. So they're going to get that off of there, but we can still pull that again at a local level with our custom reporting.
There is a question in the chat from Robbie. Sorry, Nick.
Yeah,
is any
good.
reporting going to show or be built to show the results for selections to gender and sex at the same time? So we can build that if that is a request from our providers. However, like Nick said, those are not going to be on the APR together. You're only going to see sex now on the APR. Gender is no longer going to be included there. However, like I said earlier, if you're wanting that to be reported out together, that's something that you'll have to reach out to Nick and I, and we can build something for that. Okay. All right, moving on to specific disabling conditions. We see this field being asked on enrollment screen as well as the status, like annual or status assessment, and our exit screens. Now, this field is only affected for the VA funded and HUD-BASH projects. So the following list there of the disabilities are going to be retired and no longer going to be on those screens. And that's the physical disability, long-term physical disability, developmental disability, chronic health conditions, HIV/AIDS, mental health disorder, long-term mental health problem, substance use disorder, and long-term substance use problem. Again, the next field on the program screen is family critical issues, and this is seen on the enrollment screens for our RI-funded projects. And so currently we have the responses to the family critical issue as unemployment, family member, mental health disorder, family member, physical disability, family member, alcohol or substance use disorder, family member, insufficient income to support youth, family member, and incarcerated parent of youth. That's all going to be retired and changed to the answers yes, no, and then our usual answers: client doesn't know, client prefers not to answer, and data not collected.
Sorry, real quick, Amanda, just to clarify. So these questions will still be there. It's just that instead of it being like a check, like yes or no, you now have some more options to choose from. So you don't have to answer yes or no. You can choose that somebody didn't answer or whatever. So it's sort of that core group of answers that are with a lot of the questions that they ask. They're basically just applying it to these questions now. So they're still going to be there. You're still going to have to collect it. But now you have the ability to say that you don't know the answer or the client didn't answer.
Any questions there for these fields? Okay, great. We could go ahead and move on to the next slide. All right, the next field is the HP targeting criteria on our enrollment screens for the VA-funded projects. Now, here we're just seeing some language change for the question dependency P and dependency Q. So under dependency P now we have the language change of household size of 5 or more, requiring at least 3 bedrooms due to household composition. And dependency Q now changes to household, which may include 1 or more family members meeting other criteria for targeting prevention determined by the COC. So again, that's only for the VA funded projects. With mental health consultation, this is only also affected for the VA funded projects. On the enrollment screen, there is a field added to require all veterans in the following projects. So SSVF funded homeless prevention, SSVF funded rapid rehousing, and VA GPD case management, housing retention, funding services only. So that mental health consultation is now going to be required for those projects under their enrollment screens. Any questions regarding these fields for the VA funded projects? Okay. Great, moving on. Now, lastly, we're looking into the services, the changes with the services. Our first service is going to be services provided under SSVF, and it's a new service that's going to be added called Healthcare Navigation. This is going to be, again, available starting on 10/1 under your services for that program. Again, for SSVF, we're looking at financial assistance, and they're going to add date provided under this service. This field is going to reflect the date the financial assistance was identified as needed by that participant. And all SSVF financial services will now not be a single event and delivery type. That's how it's been historically, I believe, since I've been here.
Sorry, I meant to put now. That's a typo. It's now going to be single event as opposed to not. Sorry.
Gotcha. Okay.
Yes, sorry.
All right. So it was a multiple event, I think, then, and now it's going to be turning into a single event delivery type. So that's going to be starting 10/1. Sorry for the confusion there, the typo. Any questions? No. All right. If any questions come up on 10/1, like Nick mentioned earlier in our agenda there, we do have all day to be available for support once these go live. But again, please make sure to not do any data entry between 8 and 10 so that we can make those changes available for you guys to be able to start collecting live. I do believe Nick has a document up now that highlights those different data standard changes that we've just went over, what screen they're found on, what element is affected, and what projects are going to be included in those changes. I don't know, Nick, was this something that was sent out in the invite as well, or
Yes.
is okay?
Yep,
So you can
so it
find
was
this
in
in
the
your
invite.
invite.
Yep.
And then is this going to be something also that's going to be included on the website?
Yeah, I'll put it on the website as well. So well, you should have it in the meeting invite, but this goes over everything pretty quickly. It's just the basics, right? So really, I mean, for the majority of projects, right, the big changes are that we're adding in um, the addition of sex and getting rid of at a federal level, of course, but we're getting sort of, but we're still going to require it locally, gender, sexual orientation, translation assistance needed. So that's really the big changes. And then for VA projects, there's just one additional data element that they're requiring. So I know it might look like a lot, but really at the end of the day, a lot of what we're already collecting is still going to be collected at a local level. And there's only a few things that have been added. So it's a good thing. We've definitely had other years where we've had many, many, many changes, and additions and removals, and so this isn't so bad, comparatively. So that wraps up the changes. So is there any questions about this? Nothing, huh?
Not seeing anything in the chat either.
All right. All right. Well, with that said, let's look forward, and look ahead to some exciting things that are coming your way. And we'll start off with CE redesign. So we've been talking about this for years. Okay, it feels like anyway. But we really are at a point where we are going to make those changes and really get started with opening up essentially the access points to coordinated entry. So, as most of you know, right now we have a single access point through CI at Frontline. They've done a fantastic job for years and years and years now. And so, but really, what we've heard, right, is that there needs to be more access. There needs to be another way to get there, another way to get those assessments completed, another way to get referrals. So it doesn't have to be streamlined through one entity. And I think that coordinated intake will tell you that it's overwhelming. There's a lot of people that are calling. We've had to make some changes. We've added 211 to the mix to sort of screen out a lot of the calls. But that's required time, money, energy, right? All the things that we're not all of us have, right? Um, so what we're going to be doing, and this is at a high level. So if you have questions, I'm happy to answer them. But really the nitty gritty, the details, we're not really sure yet. It's going to take some time to work all this out. And we're going to have coordinated intake with us along the way. And those of you who will be doing these assessments, we'll get some feedback from you as well. So essentially what we're going to be doing is opening up three different access points now. So we're going to have the call center, right, which is the traditional CI that we all know and love, traditional phone-based coordinated entry. So the same sort of process that we go through now, that'll still be available. And we'll also be allowing the large shelters, YWCA, well, I'll just call it Norma Her and 2100, right? We're going to allow them to also provide those assessments. So they don't need to call coordinated intake because they're at shelter already. You all can just then become an access point and make a referral to yourself, and we'll get credit for coordinated entry making that referral through your own agency. And then, of course, our outreach providers. So those of you who work in outreach could probably attest to the fact that, it's also a pain to have to always get your folks that you're working with out on the street connected with coordinated intake, get them a referral to maybe a shelter, to rapid rehousing, whatever it might be. We're going to allow now outreach providers to become an access point and make referrals the same way that coordinated intake does. So, um, what you'll notice over on the right-hand side is that the opening up of access points requires a change in how people make referrals or how those entities are going to make referrals. So coordinated intake or the call center will still make direct or community queue referrals, and we'll talk about the community queues in a second. But projects can be directly referred to, or you can put them on what's called a community queue, which is essentially a list of people that the provider that they're referred to or shelters, right, would go in and pull them off the list, as opposed to coordinated intake specifying which shelter they're going to go to. It's essentially just a list of people that then that shelter that they end up at can just pull them off of and make a referral to themselves. So it limits the amount of direct referrals that are just sort of hanging out there. Okay. Carla, it's a good question. Senior guest house is a shelter, and you would be part of this queue. You won't be doing the assessments, though. You won't be an access point, if that's what you're asking. So those shelters, we won't be adding anybody. If somebody goes to shelter and they get a coordinated entry assessment, um, and again, these are the bigger shelters, so we're talking just Norma Her and 2100 right now. They're going to make a direct referral to themselves. Okay, they're not going to be making referrals to other shelters. We're not going to, this rapid rehousing and PSH process will remain the same, but they're not going to be sort of making direct referrals to anybody but themselves because they're already at the shelter. There's no need to make a referral elsewhere. If they need a referral elsewhere, they would have to go through another entity. Carla, you would not. You would just be doing, well, you'd be doing a housing assessment, yes, but that you would not be doing a coordinated entry assessment. So you won't be an access point. You'll still be doing all the stuff that you would normally do to get people housed. But that's not coordinated entry. So outreach. We're going to be outreach will be making those community queue referrals. So the reason we decided to do it that way was because there's no need for every outreach worker to know every single eligibility criteria for every single shelter to make direct referrals. It's easier just to put them on a queue and get them, send them to a shelter, whatever one they're eligible for, of course, but send them to a shelter and that the shelter can pull them off the queue. Does that make sense to everybody? Again, there's going to be more detail coming out about this, of course, but um, you still need to call as well. No, absolutely not. So if you are at Norma Her, which Vita, so Vita's question in the chat was, will they still need to call as well? No. So the idea here is that you all, as those larger shelters, will be able to complete the coordinated entry assessment without having to call. And so that referral will come directly to your shelter. You're basically making a referral to yourself, right? And connecting them that way, as opposed to having them call. And then, I think it's really exciting because really, how many times have we said on calls where we said, hey, they need to go through coordinated entry before we can, get them a referral to PSH or a referral to rapid rehousing. Um, it's a lot, right? And so now you have the ability to do it yourself. And again, this is only applying to the larger shelters because the volume is just so much greater there. We're hoping that a lot of the people that go to these smaller shelters, right? So the senior guest houses, the family shelters will still require some phone calls, but we're hoping that referral should come from coordinated entry to control the flow into the smaller shelters. Right now, people are just able to show up at these larger shelters, and so we want to make sure that if you're a smaller shelter, that people are getting a referral to you as opposed to the other way around. Okay. Vita's very excited. Thank you, Vita. This is good. Um, okay, so let's talk real quick about what the community queues are going to look like. So we're going to have multiple community queues. So if you're a rapid rehousing provider right now, coordinated entry, right, you are aware of the fact that we're already using a community queue for rapid rehousing. So as somebody calls coordinated intake, they're making an automatic referral for pretty much everybody to rapid rehousing by placing them on what's called a rapid rehousing queue. And then what happens is the rapid rehousing provider goes on, which is mostly Eden, right? Goes in there, grabs them off the queue, and applies the referral directly to whatever funding source they're using to support that person in rapid rehousing. We did it that way because it's really hard for coordinated intake to know where Eden has availability, right, on their different rapid rehousing grants. So that has helped us get to this point. However, we're going to open this up a little bit wider and make different queues for different project types. So we're going to have a single emergency shelter queue. We're going to have a family emergency shelter queue. We're going to continue the use of the rapid rehousing queue. We're going to create a permanent supportive housing queue. And we'll talk a little bit more about that in a second because that's a little bit more in depth. And then we're going to have a grant per diem queue. So if you're a VA provider or a GPD provider, you have GPD beds in your shelters. It's one of those things too where we don't know exactly which type of bed they're going into. Sometimes places have different bed types, and so we're creating a queue for that. So you can just pull them off the queue and put them where they need to go. How's that sound? Everybody, any questions about that? So yeah, uh, we're gonna have extensive training on this. Okay, we're gonna pull you all in. We're gonna make sure that everybody knows what's going on before we roll it out, of course. But we just want to make sure you know that this is coming and be prepared. And again, we'll have office hours and be available throughout that process. It's a big change, right? It's a big mind shift for our community, right? We've always had one single access point, and we want to expand that. All right. So some of you have already been involved in this next one, and it's really close to being done. But we're gonna have what's called a universal supportive housing application, or what we've lovingly been calling the USHAP. Basically, it's going to be an HMIS based application for both PSH and rapid rehousing. So it functions as both. Um, we have, this means that there's not going to be any more uploading. There might be some uploads in terms of, like, birth certificates and things that you have that we might need. but there's not going to be this huge packet you have to upload in the right order, making things a lot more difficult for you. We don't want those large packets floating around. So that's what we're going for here. And of course, we're not going to be confused, right, anymore about which application goes for which project. So now, a scattered site, a rapid rehousing, and a building application are all the same. So we don't have to worry about which one to use and when. Um, so we have this really, really close to done. This should be going live pretty quickly, I would say, probably before the end of the year for sure. And I can show it to you, I guess, but I don't want to get anybody too confused. But there's basically a lot of the questions that you're used to filling out on the application. We've basically uploaded or sort of created in HMIS, and then you'll run a report for each of those applications to pull it out. So yeah, everybody's going to have access to the USHAP. You will have to have your folks. The slotting process is not changing though, so you cannot just go into HMIS and complete a USHAP and think that your person's going to get housing. That's not how that's going to work. You're going to complete a USHAP once we have been slotted the way that we have been slotting for the last almost year now, since basically November of last year. So everybody will have access to the USHAP, but you should not be completing it until your person is slotted. And yeah, their name is on a list, and you know that you need to complete it. Okay. So again, there's going to be extensive training on this. What about people who don't have access to HMIS access? So the paper form will still be there. We have the paper form, the paper application. That's the one form that we actually will create, because we're gonna have a paper version of that for people who are not in HMIS, that can still submit it to coordinated intake, and they'll have to upload it for us. But that's the only like paper we really want floating around, again, outside of like social security cards, birth certificates, and those types of things.
Can I just jump in here real quick, Nick? I want to
Yep.
piggyback off of that. So the people who don't have HMIS access, this is going to be, a paper packet then. To make sure that we have this universal application be acceptable for the different programs. Different programs and different housing opportunities have different requirements for the application. So um, in addition to the USHAP, the assessment that Nick had explained, to pull out as a report, we also have additional forms set up in the system to compensate for maybe something that's specific for scattered sites, or something that's specific for PSH. So that will be combined together in the pack in the paper form. And Nick, when we do the training for this, we'll explain what forms are going to be needed for what projects or housing opportunities. So I just want to put that out there, that if you get the paper form for the non-HMIS participants, it's going to look still like a packet, because we did have to build those additional forms to compensate for the different eligibility for different offers and opportunities. So
Yeah, thanks, Amanda. Yep. So, some of those things like statement of zero income, the, Eden release of information, the compliant grievance and appeal procedures, all those things that were sort of at the back of the USHAP that everyone had to sign off on. We've created those in HMIS so that you can just do them in there, and have the client sign in real time. The training for that will take, so the question was, when will that training take place? We will absolutely let you know. We don't know. We're waiting for it to be completed, with the vendors helping us with that. The focus is completing it for us. Once it's complete, and we will set up a training, and we'll let you all know when that is going on. Yes, the other question is, will the disability verification form still need to be uploaded? I'm just looking here because it looks like it's not in here, but that makes sense because it has to be signed off by a provider, so they might not have access to HMIS. So yes, that's something that's probably still gonna have to be uploaded. So we tried to get rid of all the forms that we could, but obviously there are some that are gonna have to still be uploaded because we don't have right. The provider has like a licensed professional has to sign off on that. So we can't have them, in HMIS to do that. And of course, like I said, birth certificate, social security card, identifying information, right? Identifying documents, I should say. Those also have to be uploaded.
So
Also,
I can
oh,
I ask a
go
question?
go ahead. Yep.
All right, I'm at the Salvation Army. I have access to Clarity, so that means I'll be able to do my applications in the system once this happens.
Yes.
My coworkers that don't have Clarity, they're gonna have to continue doing a paper packet?
No.
No? Okay.
So they can, and then you can have someone upload it, fill it out in the system. Because you're an HMIS participating provider, you will need to do the USHAP in HMIS. You cannot submit paper forms because you're in HMIS. We have amended our contract with the vendor to include more licenses. So if people need licenses, please let us know. We're happy to link everybody at this point. We have
Okay.
a ton of new licenses available. And it's for this purpose because we knew there's going to need to be more people in it to complete some of this stuff.
Got it.
That's a good point. Thanks, Jeff, because I didn't really think about that. But yeah, if you have other people who are not in HMIS, that doesn't mean that they can still submit paper copies to coordinated intake. Because you're an HMIS participating provider, the agreement is that it's going to be done in the system.
I also want to touch here too that we were able to make this happen in HMIS because we were also now able to obtain client signatures in the system. So when you're filling out these applications and assessments in HMIS, you're not going to need to print it off and then have the client sign and then re-upload. You can have your client sign right on the system there. Similar to how you guys sign your end user agreements at the start of your access type. You could just have your participants next to you filling out the application and then have them sign with the mouse. You don't need to have the attached signature technology to do that. That's something that is updated in the system now so that we can use for the USHAP purposes.
Can I ask a question about that? So if we're out in the field and someone signs, if some of our team members are using the paper application that we're then going to upload, and someone signs that paper, is there a way then to upload that signature if they didn't sign electronically?
So this is a good question. Thanks, Chelsea. So I just want to, I figured I'll show you. There's a good question. So I'll show you what we have created. So let's say you have, like you said, somebody guys out in the field. We have, let's say that this form, you got a paper signature, right? Because they were out in the field. You can then select it and then hit upload the scanned version of the form. So then you can just upload it to this form as opposed to completing it in the system. Okay, so we did make sure that we had a place for that just because we know that people are going to be out in the field, of course, and we'll need that to do so. Just a quick note, though, that Clarity is mobile friendly. So if you have tablets, phones, you are able to do this on your phone as well. So,
I see Nikki put a question in the chat. I don't know if that was also why you had your hand raised. Yes, that the question is, if the application is not completed in its entirety, will there be a mechanism to flag what is incomplete or not allow for saving, etc.? That's a great question, Nikki. We have included the fields to be required for this purposes. So that means that you will not be able to move forward or save it until it is completed in its entirety. So just take that note that this may be where the paper copy comes in handy, where you can have it filled out in pieces if needed. But then once you're going to enter it in the system where Nick has it uploaded here, you're going to need to have it completed in its entirety. Otherwise, it will not save.
Yeah, so that's the application itself, and I think that what we will need to create, though, is this additional sort of flag system, if you will, for those other forms that might need to be attached to it. So we probably can create a custom report that we can pull and make sure that, basically check mark, right? Here's, yeah, the USHAP's done, this form's done, this form's done, this form's done. And then make sure that that's how we'll know if it's completed in its entirety. So here is just a quick glance at what the USHAP looks like. It's got a bunch of questions and you'll basically be filling them out the way that you normally would. You have the signature clause at the end. You would have the head of household sign. If there's a co-head of household, you'll have them sign here. And then basically you'll be pulling it out by running a report. And I'll just quickly show you what it looks like. And again, you might not be pulling it out. So once you complete it, you probably don't even need to pull it out, right? That's going to be sort of the housing provider's job to look at it, and they'll pull it out using this report function. But it looks like an application. So that was the biggest challenge, was trying to make it look like it normally should, right? And not just a bunch of check marks and written in fields and things like that. So here's, it'll look just like this. You're able to print this out if you want to, for your own records, however you choose to do so, or however you choose to sort of track it on your end. But this is what it looks like. And it's not quite complete yet. We have some things that we've added and made changes to, but this is where we're at. Any other questions? Latasha, go ahead.
I just want to make sure I heard you correctly. And you stated only to fill out that portion when that client, it was slotted for a particular program, correct?
Correct. Yep.
Okay.
Yep. Just like you guys do now, right? Just like when you guys are working with some folks, right? And Nikki comes to you on those Tuesdays and says so and so and so and so and so and so are slotted. You're the worker. Then you would go in and do the application, right? Like that's what you do now. It's the same process. As soon as you're told, then you have that 2-week period to get the USHAP completed, basically. Okay. Another fun change. Okay. So Amanda and I just went through an 8-week training series to get this, what's called the inventory module, up and running. We are fully trained and ready to go. But basically what this is going to be doing is tracking our housing units in real time. So housing providers, you're going to be receiving an email from me about our initial meeting, to where we're going to gather all the information as much as we can from you, figure out what it is that we want to collect in this module, and we're going to basically be sending out a spreadsheet that has all of the units listed, and we have to create a bunch of different things for this, but the initial work administratively for us is going to be huge. But for you all at the housing provider level, you're going to need staff capacity for sure. Okay, to sort of maintain this. We're going to manage the back end on our end, but you're still going to have to sort of be placing people into units, so basically what it looks like, right, is we have all these different PSH units, we have different scattered site vouchers, all this stuff. What we don't have is a really great way to see who's in what unit, all the things that are moving around. What do all the units have? Is this ADA accessible? Is there an elevator in the building? Is it, right? All the things that folks might need. And we're sort of relying on the housing providers sort of tell us where people are going. We're creating this inventory module so that we are able to track it in real time, have a better sense of when units are offline, why they're offline, how long are they offline, are they available, is it occupied, who's in that unit. Okay, so we're going to be tracking it by unit, right? So like I said, we're going to need to gather a ton of information on the front end. This is not going to be happening quickly at all. We are going to work our way through this. Slow and steady wins the race, right? And so if you're a housing provider, be on the lookout for an email from me. And we will let you know in the initial meeting sort of what it is, what it looks like, how it functions, and why we're doing it. But that's where we are at. I know it's really vague, okay, but is there any questions about this? Okay, I see a question in the chat from Nikki. Should providers refrain from completing applications for participants identified as backups? I would say no. I would say that the backup should still complete the application. They will eventually be slotted for something relatively quickly. So if you're a backup, again, if you're familiar with the slotting process, if you're a backup right now, you're basically completing the application too, because if that primary person falls out or decides they don't want it, that backup person will take that spot. And you have sort of less time to get it done, right? So yes, we would still encourage people to complete the application because eventually they're going to um, they're going to use they're going to be slotted for something. So inventory is coming. Coordinated intake, by the way, you'll be involved in the inventory stuff as well. You're going to be pretty integral in deciding sort of, what's available and what's not deciding, but, sort of linking people to the different units. The PSH queue, the community queue that we were talking about before, that's basically going to function as a unit queue, where, you're going to put people into a queue and then assign them to a unit, based on the needs and all that stuff. So there'll be more to come on this, but that's coming your way. And I think this is the last one, the outreach module. So we rolled this out like 2 years ago. And we did not do a good job at sort of maintaining it. And I say we as an OHS. And it's really me because Amanda wasn't even here. So I did a poor job of maintaining it. The seasons changed, how the seasonal shelter, all that talk, it gets ramped up. And, we sort of lost track of this. We are going to start doing this again. We're going to start tracking our encampments and our unsheltered homelessness in real time. It's going to help with a ton of things, right? It's going to help with understanding the data behind our unsheltered homeless folks. It's going to help us understand where people are. What needs does each individual encampment, not person, but the encampment have? Do they need weather protection? Do they need food? Do they need basics, clothing, right? What do they need? And can we deploy services in a way that will help those folks there and hopefully get them to a point where they can either move into housing or get off the streets into a shelter? So we are hoping to roll this back out. Okay. Outreach providers will be primarily responsible for maintaining this sort of outreach module, putting people into it, applying describing each of the encampments, the stuff that you probably already know. Maybe you do track it already, but we want to be able to see it at the COC level, so that we are able to accurately advocate for funding if that's the case, or accurately just tell the story of what we're facing in our community. Because right now it's really difficult to do that, at our level. Okay. So, like I said, what's really exciting about it, I think, is that we really, really want to be able to understand what services are needed at those encampments. So it's not about tracking people where they're at, and that's not our goal here. Our goal is truly to make sure the services get there. And we want to be able to coordinate, right, with even like the city to get maybe trash, receptacles out there, or clean up that street, or whatever it is, right? We want to coordinate as best we can with people, and this is going to be a good way to do that. Because we have the city, they're in HMIS. We have, our outreach providers are in HMIS, or the counties in HMIS. So there's a lot of different things that could work in collaboration here to really help those folks who are out there when they need it. So outreach providers, you will receive an email from me about when we're going to get this additional training up and running. I think it's going to require some changes into what the workflow used to be, and because things have changed, of course. But you'll get an email from me, and we'll schedule a training. Okay. Dennis, your hand's up. Go ahead.
Okay, okay, you're saying that, so even if we're dealing with people on the street that haven't been housed, trying to get them housed, and they're in a campsite, say,
Mhm.
so we're gonna try to provide resources to them, like like you said, like clean the place up, trash receptacles and stuff like
Mhm.
that.
Yep.
Maybe even if it's big enough, maybe even porta potties,
Yep.
Will that
Yep.
happen? Or that's just a dream?
It seems like a lofty goal, right? And that is absolutely what we are trying. That's what we're aiming for. Okay. We want to be able to be very clear with the folks who need the information that this is why there's X amount of people there. It's unsanitary, right? And whatever. And we'll be able to prove that with the outreach module, right? We'll be able to say, look, we've got the data on this. We know who's there. We know what the needs are. Our outreach providers are there all the time. Here's the team that's assigned them. We can assign different teams to them, right? So I'm hoping this works. That's the really lofty goal that we have, is that we can work in tandem with those folks that can provide those resources, and get and basically just make it a dignifying place to be, as dignifying as it can be, right?
Right. Yeah, because I mean, basically, that's what we've been doing since I've been doing this.
Mm-hmm.
We go visit the people in the streets. You know, we're not doing anything but that. You know, I mean,
Yep.
we're doing a whole lot of other stuff, but I mean, basically, we go out every morning. We go to the campsites. We go see people. We house. I mean, we have housing clinics.
Mm-hmm.
Where we have a place to sit down and do applications, referrals, and find out what they're qualified for or not. But
Yep.
with someone else behind us, I
Yep.
feel like it's just NEOC doing. I mean, I know it's not just NEOC, but I'm saying it's just outreach
Yeah.
workers. I should say is doing it, not just NEOC.
Yeah.
And
No.
I think
No,
that would
hey,
be a great thing if we could get that going.
yeah, don't minimize your role. NEOC, you're the big player, right? You're the big outreach player here, and we understand that. And there's other outreach providers on the call too. We appreciate all that work that goes into this, and now we want to be able to just see it and be able to say, look, this is all the work they're doing. This is what NEOC's doing. This is what PATH's doing. This is what, we be able to see that in real time. And I think that has been missing from our community for a really long time, to just be able to say, like, look at all the work that's going into this, right? This is not just, a bunch of folks kind of just moseying around town, right?
Right, right, exactly.
There's work being done here, and there's more work that needs to be done for these folks who are out there. So yeah, I appreciate everything that you do, of course, and I want this to be able to support that effort in a way that will really lift it up, right? To show folks what's going on.
Yeah, right. Showing that we are trying because we are held accountable for getting, I mean, the front line or Nikki and them and you two, pick the people who's with the house because of whatever their situation may be. But they feel like we do it.
Mm-hmm.
You're not housing, you house this person, but you ain't housed me. But
Yep.
it's not, that's not it. We
Right.
catch all the flack. I
That's
mean,
because
we
you're the
catch.
face. You're the
Yeah,
face of the place. Yeah.
I mean, what we be told, cussed out, and nobody's doing anything. Nobody cares. It's
Yeah.
a waste of time. And because our homeless people, I think a lot of people need to know that they've been told no so much, or have caseworkers that don't do anything for them. Really go to
Mhm.
bat. You know what I'm saying?
Yep.
And
Yep.
it's hard out there.
Yep.
I think I speak for all the outreach workers. It's hard out there.
Mm-hmm.
It's not easy. I mean, it's not an office you're going into. You're
Mm-hmm.
going into a jungle. You know what I'm saying? The streets.
Yep.
But
Yep.
I mean, I'm just glad to hear what we're trying to do.
Yep.
And I thank you all for it.
Thanks, Dennis.
Peace.
Couple questions in the chat. go ahead, Amanda. Do you want
I was just gonna say, yeah, there was a couple of questions in the chat that went over or was asking from things that you already presented. And one of them, Nikki asked if there's a way to update dates on the application if the original date falls outside the designated time frame, excuse me. Thinking of the backups who may be slotted as primary for months to come. Yes, there is the option to update that. Obviously, we ask that you just review the data so that it's up to date. I do think that we'll probably touch more on the training, but if it's an extensive period of time, we probably need to require a new application.
Yeah. But I do think that that was part of the goal as well, right? It's a good question, is that we didn't want to have folks to have to go back and change, update the application and, well, not update it, but to redo something, those forms that you would have to get re-signed and redated, you don't have to do that anymore. You just change the date, right? Like we're trying to make this a little more streamlined and less cumbersome on those of you who have to do the application. So I think we'll figure out timeframes, but for now, that's where we're at. Yeah, so the other question from Nikki was if someone is at norm or her 2100 or unsheltered, those providers are responsible for completing the intakes, not CI, correct? So this is back to the redesign conversation. Let me just back up. And it's question time anyway, so this is good. So yes, the answer is yes. The shelters, those norm her 2100 and the outreach providers, you all will be responsible essentially for completing the intakes. You won't be having them call coordinated intake because you don't feel like doing it. The whole point of opening access is to make sure that they have access when they want it. And so having them call CI sort of defeats the purpose. Now, I do think there's going to be a level of coordination that might need to happen with coordinated intake. I think specifically with not necessarily from the shelters, because like I said, they're only going to be making referrals to themselves, but for outreach providers, right, where they might not know what somebody's eligible for. So maybe there might be a way that we'll create some sort of line of communication to make sure that they well, we're going to train them on what the eligibility is, of course, but as turnover happens and all that stuff goes on, there might be there's a level of collaboration that's going to be needed, I think. But again, that's sort of why we did the queue. We went the referral method as the queue, because then we might not need to have the outreach providers know everything about every shelter. They can just throw them on a queue, and then wherever that person ends up, that they can pull them. And with the outreach module, I think it's a good point too. Nikki said this is a game changer for a Home for Every Neighbor. I want to point out that a Home for Every Neighbor is actually already using the outreach module. They're the only ones that we sort of called it a pilot at that point, but they're the only ones using it right now, and it's actually been super helpful. We've been able to see, who's in what encampment, who's housed. So when somebody gets housed from that encampment, there's like a little badge that shows up that shows people that go into housing from that encampment, or it shows that that person went into shelter, right? So it's been really helpful to be able to see all of that. And really, the work that they've done, it's just clearly there, right? Like we're able to see how many people they've gotten housed. It's really cool. It's really cool to see.
I also, sorry if you already touched on this, Nick, earlier. This is a goal for the continuum to be able to track on our homeless days too, where we can pull the report to track the different days that may not come from like the HMIS history from different program enrollments, but we can pull the report to track the homeless days if they're staying in an encampment, like Nick pointed out in the outreach module. So that's a long-term goal that will help out too.
Yeah, that's a really good point. Yep. And we have reports that we can build, or that we already have built, that will help us pull in that data. And then we don't have to verify all this chronicity, right? If somebody's been homeless in our community for a really long time, we'll be able to see now those encampment days as well, to help us get away from the idea of having to submit a form to cover something, right? This is going to take time, but this is why we're starting now, because we want to be able to see this in moving forward to where HMIS can just be the source of truth, right? And we don't have to rely on self-reporting and outreach providers, observations, and those things that we'll be able to see it now, and we'll be able to pull it, and we'll be able to have to worry about, is this too vague, right? Is this not making sense? Do the dates match up, right? So we're working towards something a lot bigger, and I just I hope everyone can see that, because it's gonna take all of us to make it happen. So yeah, that's where we're at with this. So essentially what you're seeing is that there's going to be pretty much a training series, right? Going to be happening where we're going to start with sort of probably the USHAP will end up being first, because we're sort of at that point where that's going to be done. But then we'll get into redesign. We'll pull all the necessary parties in for each of the different access points. We're not going to overwhelm everyone with all the information. We'll put all of it, we'll change all of our policies and procedures in terms of coordinated entry to reflect these things, so that you'll understand where people are going. How does the USHAP play in? What does slotting look like? How does the outreach module play in? How does inventory play in? So all of these things are coming at once because they all link. And Maine and I have talked at length about how it is overwhelming, in even for us, and we can only imagine what that feels like for you all. But we're going to try to break it down as best we can, so that not everybody's confused or overwhelmed with that information as well. Are there any other questions? Okay. Well, as always, feel free to reach out to us. We're available. Quick note, probably already know this, our emails and phone numbers have changed. They are in our email signatures. So please keep, just note that. If you aren't already, please sign up for our OHS listserv, our email list. Some of you I've added manually. Others you'll have to go in and sign up. I can find that link and put it in the chat. But that's going to be sort of the best way for us to. That's sort of how we're sending out all of our communication now. You guys all received just sort of the meeting invite from me for stuff like this, but I'm talking about the bigger things. Funding opportunities, new project applications, OHS advisory board information, right? All that stuff that comes from our office is now going to come through this listserv. So let me see here.
Is it the
Yeah.
the newsletter?
Yeah. Yep. I just
Okay,
put it in
I
the chat.
Oh, gotcha.
Yep. So feel free to sign up. You'll get stuff from us that might not apply to you, but it's better for you to know than not know. So please sign up for that, should you feel it necessary. Okay. All right. Well, thank you everybody for being here, and we will let you go. If you have any questions, call us. Talk to you soon.
Thanks, everyone. Have a great day.
Thank you. Bye-bye.
Thank you.
Thank you. Bye.
Thanks.
Bye.
Bye.
Thank you.